Adrenergic antagonists. So, adrenergic blockers are basically drugs that bind to adrenergic receptors and prevent the action of adrenergic drugs. So, they may either block alpha receptors or beta receptors. You can go back to the introduction video and learn in detail about the different receptors and the classification of adrenergic agonists. In this lecture, let's talk about antagonists. Now, first, alpha adrenergic blocking agents. These block the effects of alpha stimulation. So, we had studied alpha 1 stimulation causes vasoconstriction, glycogenolysis, relaxation of smooth muscles, and alpha 2 stimulation caused decreased in the release of norepinephrine from nerve terminals. So the blockade of alpha 1 receptors inhibits vasoconstriction, leading to vasodilation and thereby reducing the blood pressure. Alpha 2 blockade causes increase in the release of norepinephrine. So now this increased norepinephrine release secretion is available to act on beta receptors. So this stimulates beta receptors, and beta 1 stimulation causes stimulation of the heart. So there's tachycardia, increased cardiac output. Thus, the predominant effects of alpha 1 and alpha 2 uh, blockade are hypotension and tachycardia. Now, alpha blocking agents can be divided into different categories. There are non selective drugs, irreversible such as phenoxybenzamine, and reversible such as talazoline. Now, phenoxybenzamine acts for almost 3 to 4 days with gradual decrease in BP. So, it may be used in conditions such as pheochromocytochroma. Selective, there's also miscellaneous such as ergot alkaloids, and selective alpha blockers are selective alpha 1 blockers and selective alpha 2 blockers. Selective alpha 1 blockers are prazosin and alpha 2 are yohimbine. Now, prazosin is a highly selective and a potent drug with 1000 times greater affinity for alpha 1 receptors. So, what this does, it causes arteriolar and venular dilation and decreased peripheral vascular resistance and decreased cardiac output. And it has selective alpha 1 action, so there's no significant tachycardia and there's no increase in norepinephrine release. So this is a alpha 1 blocking agent, and yohimbine is a highly selective alpha 2 blocker, so it increases norepinephrine release, and it also causes congestion of the genitals, so it can be used to treat psychogenic impotence. Uses of alpha 1 blockers are: 1, hypertension. So alpha 1 mediated action, it is used in the treatment of hypertension, phenoxybenzamine, phentolamine, etc. Pheochromocytochroma. Now, this is a disease where the adrenal medullary tumor, it's a tumor in the adrenal gland which secretes large amounts of catecholamines, resulting in hypertension. So, this tumor has to be surgically removed, but phenoxybenzamine and phentolamine can be used in preoperative management of the patient. Now, peripheral vascular disease. Due to peripheral vasodilation, it may relieve the symptoms of peripheral vascular disease, symptomatic relief. Congestive cardiac failure. Now, because of vasodilator mediated action, prazosin is useful in CCF and benign prostatic hypertrophy, enlargement of the prostate gland. It results in lower urinary tract symptoms. So there's basically incomplete voiding, urgency, and blockade of the flow of urine from the prostate gland, so from the bladder. And the administration of prazosin, it reduces the resistance to the urine outflow. So these are the uses of alpha blockers. And alpha 1 selective drug was prozosine, and alpha 2 is yohimbine. Let's come to beta blockers now. Beta blockers are drugs that block the action of catecholamines mediated through beta receptors. So they can be first generation, which are non-selective. They act on both beta 1 and beta 2 receptors. Second generation, which primarily act on beta 1, so they're beta 1 selective. And third generation, which have beta 1 action plus vasodilatory action, so beta 1 plus alpha 1 blockade. So drugs that come under first generation, they are timolol, propranolol, pindolol. Under beta 1 selective are atenolol, metoprolol, and third generation are carvedilol, labetalol. So coming to this is what we had studied, was the beta recepted stimulation of the beta receptors. So beta 1 had excitatory effect on the heart, and beta 2 had relaxatory effect on smooth muscles. It also caused glycogenolysis, so increase in blood sugar. So the blockade of these three receptors has the following effects. Hypertension. Now, in the cardiovascular system, beta blockers, they decrease the heart rate, the force of contraction, and the cardiac output, and the blood pressure falls. So the myocardial oxygen requirement is also reduced due to reduced cardiac work. So this is useful in angina pectoris, cardiac arrhythmia, myocardial infarction. In the respiratory tract, now the blockade of beta 2 receptors causes an increase in the airway resistance, because the beta 2 action was relaxation of the smooth muscles. Now it tenses the bronchial smooth muscles, and it increases airway resistance. So this can basically precipitate an acute attack in asthmatics, which is why it's contraindicated in asthmatics. On the eye, it decreases the intraocular pressure, and it decreases the secretion of aqueous humor, so thereby it can be used in glaucoma. Metabolic effect, as you can see, it blocks glycogenolysis and gluconeogenesis. So this is why it may be contraindicated in diabetic patients. It has to be used carefully, because it might prevent the recovery from hypoglycemia by already decreasing the production of glucose. Adverse effects are bradycardia. So decreased AV conduction, AV conduction defects may develop, arrhythmias, heart block. In congestive cardiac failure, the heart is basically supported due to sympathetic activity. So the blockade of this sympathetic activity may precipitate CCF. Cold extremities, especially in patients with peripheral vascular disease, it is contraindicated. Beta blockers may precipitate an acute asthmatic attack because of beta 2 blockade. There's fatigue, CNS, metabolic effects due to reduced glycogenolysis and gluconeogenesis. So the uses are in hypertension, angina pectoris, cardiac arrhythmias, CCF, obstructive cardiomyopathy, pheochroma, cytochroma, glaucoma, and prophylaxis of migraine. Again, this is due to vasodilation of the blood vessels, of the cerebral blood vessels. So this was all about adrenergic agonist, and what I suggest is, more importantly, to always try to remember the effects at different receptors, at alpha and beta receptors. It makes alpha adrenergic agonist and antagonist, both very easy. Thank you so much for watching, and stay tuned for more. Thank you.